Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question is going to be, is exercise medicine following an acute concussion? And the answer to that real simply is yes, it is. Exercise has been shown to decrease time required to recover from a concussion, but also decrease the symptoms faster, improve return to sport and return to play or work or schoolwork. And so exercise is super important following concussion as long as it's a sub-threshold and graded exercise, which we'll talk about. We're going to talk about a couple of papers in this one that both show how good exercise is following a concussion. This is important for people to know. This is important to get the message out to everybody because most medical neurologists, most doctors, most ER doctors that you go to following a concussion will tell you to rest and just to rest until your symptoms are decreased and then you can start doing things. They say to rest in a dark room for a month. They say to not do anything. And that is some of the worst advice as long as you don't have any severe, trauma to your head, skull bone fractures, those kind of things. Um, if you have the ability to get up and move, then you should get up and move. You should exercise in some way. Aerobically is best, whether that be on a bike, recumbent bike, or a treadmill, or just walking outside. Getting aerobic exercise is getting blood flow to your brain. Getting blood flow to your brain is going to help to heal. It's going to help to decrease the inflammation from the brain after the concussion, decrease the waste that has been building up, and improve overall outcomes. So I hope that was a good intro here. And let's go to the first paper. Both these papers are from 2018. The first one here is earlier time to aerobic exercise is associated with faster recovery following acute sport concussion. Okay, it is from the Cleveland Clinic in 2018, and the objective was to determine whether earlier time to initiation of this aerobic exercise following an acute concussion is associated with a time to full return to sport and school or work. Okay, so there's a retrospective study that looked at acute concussion, so less than 14 days, and the time they initiated aerobic exercise, um, both time and days of full return. Okay, and so with the results, they had 253 acute concussions. I'll show you kind of the breakdown later. And for each successive day in delay, this is the result. For each successive day in delay to initiation of aerobic exercise, individuals had a less favorable recovery trajectory. So initiating aerobic exercise at 3 and 7 days following injury was associated with a respective 36.5 and 73.2%, respectively, reduced probability of a faster full return to sport recovery to within 1 day. So if you start within 1 day of a sports concussion, of aerobic exercise, that is going to improve your outcomes. Also, a reduced probability of faster return to schoolwork. Okay. Um, so the conclusion is earlier initiation of aerobic exercise was associated with a faster full return to sport and school or work. The study provides a greater insight into the benefits and safety of the aerobic exercise within a first week of concussion. Okay, so real quick, this is kind of what they looked at or what they did. So um, primary exposure of interest was time to days. Okay, it was self-initiated aerobic exercise was defined as jogging, running, swimming, cycling, or a utilization of stationary aerobic equipment. If it was physician prescribed aerobic exercise, it was generally uniformly met with a stationary bike, where the protocol was 15 minutes initially, maintaining 100 to 120 beats per minute. So that's relatively sub-threshold. It doesn't seem like you're working very much. Then they move up to 30 minutes at that time, then 30 minutes with a higher heart rate, and then maybe getting up to maximal sprint for 1 minute every 5 minutes, okay, for that total of 30 minutes. So that's just kind of an example of this kind of sub-threshold. We'll get more into that in the second paper I show. Um, but so here in this study, they had about 148 males, 105 females. Okay, age was young because these were mostly high school athletes, um, or college, right up to 20 years old. Sports were hockey, rugby, football, were the most common, some soccer and basketball, and then lower down skiing, volleyball, snowboarding. Okay. And they, of course, looked at history of other things like psychiatric disorders, headaches, learning disability. Okay, so let's go to the graph because this is the best part of it. And so here on the left, we have proportion not recovered. So 100% would be 100% proportion not recovered versus down here means everybody's recovered. Okay. And this is time to full return in sport in days. So 10 days, 20, 30, 40, up to 100. Okay. And the time to aerobic exercise, we have a solid red line versus kind of the dotted red line. Okay, this is 1, 2, 3, 4, 5 days, going all the way up to 20 days. Okay, so you can see that if somebody started within 1 day, people were recovered 50%, okay, and able to return to sport within about 14 days of injury. 50% of them were able to return within 14 days. Everybody, if they started within 1 day, were able to recover completely, okay, and return to sport within about 21 to 30 days, okay? And as you can see, 2 days is just not far behind, 3 days just a little bit farther behind, but if you get to like 14, 21 days, you can see that for half of them to be recovered, it takes up to 40 or 50 days. This is twice as much. So twice as much just by putting off therapy, you're going to put off your return to sport as well. So this is why aerobic exercise is so important. At the same time, if we look at time to full return to school and work, it's a very similar story, yet the recovery is a little bit faster. So 50%, if they started aerobic exercise within 1 day, 50% are going to be able to return to school within 10 days, okay? Um, some were able to return to school much earlier, right? It really kind of depends, okay? But either way, most of them were by 20 days, all the way in there. And again, you look at if you put it off 20 days, man, not many people are getting back to school and work, okay? Less than 50%. It takes 60 days maybe to get half of them back to 50%. So this is just a really cool graph to get into and showing how it is so important to get early aerobic exercise, get the blood flow up to the brain, okay? So that's that paper. The next one is in exercise is medicine for concussion, okay? This is also from 2018. If we look just at the abstract, we'll see exercise intolerance after concussion is believed to be the result of the autonomic nervous system dysfunction. This is very common, okay? Autonomic nervous system or dysautonomia is very common. We see this in our clinic all the time. And a lot of times, if we're not getting blood flow up to our brain, it's because the brain is not shunting blood flow there well enough. So this is why getting exercise is going to improve. This is just kind of looking at ventilation, looking at arterial carbon dioxide levels or arterial pressure levels. And these elevated pressures of arterial carbon dioxide increase cerebral blood flow out of proportion to the exercise intensity, which is associated with symptoms that limit exercise performance, right? So therefore, elevated exercise partial pressure of arterial carbon dioxide may signal incomplete recovery from a sports-related concussion. So basically, this article reviews that sub-threshold aerobic exercise normalizes these cerebrovascular physiological dysfunction, this autonomic nervous system dysfunction, and is medicine for patients following concussion and persistent post-concussion syndrome. They looked at the Buffalo Concussion Treadmill Test and the Buffalo Concussion Bike Test to look for a sub-threshold aerobic exercise. And so what these tests do is you're on a treadmill or a bike, and the patient is asked to walk at a certain speed or bike at a certain speed. We're checking their heart rate, and we're looking for symptoms to increase. If symptoms increase at a certain heart rate, let's say at 110 heart rate, then we want to be sub-threshold that. So we want to train maybe at 100 heart rate. So we want to set the bike or the treadmill at that speed and that speed is what we're going to train at for. It'll be 15 minutes to start, 20, 30, and then we're going to work up that heart rate as well. Okay. So then if we look at the acute concussion heart rate treadmill versus bike, it's basically the same, is that maybe some people need to slowly increase versus these stages. Again, it all depends on each patient. Okay, and this is the one I want to go to. Okay, so this diagram is really nice. So after concussion, we get an initial assessment. The initial assessment, if we can start right away within 1 day of recovery and start to exercise, right? Start to do some light aerobic exercise, that's great. A lot of the times though, this doesn't happen. We don't see patients until at least 1 to 2 weeks after their concussion. And so we have more of a secondary assessment. Somebody else does an initial assessment, whether that be an athletic trainer, whether it be an ER doc, okay? And so at the secondary assessment, if they have no symptoms at rest, we test the treadmill test or the Buffalo concussion bike test. They have no symptoms, great, return to sport, perfect, okay? If there are symptoms at rest, or if there are symptoms with the concussion test, this could be an autonomic physiological part. So we need to use this submaximal aerobic exercise. This can be done if you have good athletic trainers in your school, in your kid's school. This can be done in school relatively easily, okay? Submaximal aerobic exercise to build up the strength and then get the return to sport. A lot of times what we see though, is we see patients with vestibular ocular dysfunction. Vestibular dysfunction, ocular vision symptoms, okay, or cervical spine dysfunction. We see problems with sleep, other autonomic issues like migraine, light sensitivity, sound sensitivity, maybe anxiety. And this is where we have to use some vestibular vision therapy, cervical spine therapy with the submaximal aerobic exercise, right? We are getting our patients to walk, to exercise, maybe exercise in the clinic to improve their submaximal, their aerobic exercise recovery plan. And if we can do that, then we can get a faster recovery from the concussion, therefore a faster return to work and a faster return to sport or play, whatever that may be. So I really like this topic because I think it's so important for people to understand that you don't want to just lay in a dark room. You don't want to maybe stay up and not go to sleep the first night after a concussion, right? You want to, once you get cleared for there's nothing wrong in this, maybe a CT, there's nothing, no broken bones, and like that, you want to get up and get moving right away, but within a symptom recovery. So you don't want to increase your symptoms too much, right? And so I just think this is super important, and I think everyone should know more about this. If you have any questions or comments, please leave them below. If you have any suggestions for future topics, I'd love to hear them. Thank you so much for listening today, and have a great day. Stay healthy.